Welcome to the Deep Dive. Today we're plunging into a stack of articles, some research notes, and a few personal accounts that honestly detail a story that sounds like it's straight out of medical fiction.
It really does.
We're talking about the accidental discovery of penicillin.
And it is one of those genuine watershed moments in human history. So our mission today isn't just to, recount the story. It's to really get into how a messy lab, a mold spore just blowing in on the wind, and this one person's curiosity just fundamentally changed modern life.
Our sources make it so clear. We're talking about maybe the most critical medical breakthrough of the entire 20th century, a drug that right now saves a life every few seconds, globally.
The scale is almost impossible to comprehend.
It is. And so the central question for you to consider as we go through this is pretty simple. How did the world manage to ignore this potential miracle for 10 whole years? And, well, what finally forced its hand?
And to answer that, you have to start with the man himself. Alexander Fleming. He was born in 1881 and not in some, grand academic center.
No, not at all. A small farm, right? Rural Scotland.
Exactly. And our notes really emphasize this. He wasn't a prodigy. He wasn't wealthy. His defining trait was this intense, almost relentless curiosity about the natural world around him.
That curiosity, it seems, is what drove him to London when he was just 14, and then eventually to St. Mary's Hospital Medical School. And this just sets the stage perfectly because the breakthrough he eventually makes, it didn't really require abstract genius.
No.
It required the highly trained eye of someone who's just prepared to observe an anomaly.
That's the perfect way to put it. But before that discovery, there was a defining tragedy. And that tragedy is really what gave his curiosity a focus. We have to rewind the clock almost 2 decades before penicillin to the trenches of World War I.
Right. Let's unpack the true scale of the medical crisis he saw there. Fleming served in the Royal Army Medical Corps, and the sources detailing the casualty rates they're just devastating.
It's a statistic that really defines the medical hopelessness of that era. During World War I, more soldiers died from common infections, septic wounds, blood poisoning, gangrene, than they did from the enemy's weapons.
Just think about the brutality of that reality for a second. A soldier could survive a bullet, a shell, a fall, but a week later they die from the bacteria that got into that small wound.
And doctors could patch up the external damage, but against those internal systemic bacterial threats, they had, virtually no defense.
Nothing.
This helplessness, just watching young men suffer these agonizing deaths from what started as simple wounds, it made an indelible mark on Fleming. He saw antiseptics being used, like carbolic acid, that often did more harm than good.
How so?
Well, it would destroy the body's own white blood cells faster than it killed the deeper bacteria. So this whole experience, it just cemented his conviction that a truly effective agent had to work inside the body. It had to target the bacteria without harming the human tissue.
So the war ends, but that goal, that promise to himself, it stays with him. He goes back to St. Mary's as a researcher. Now we fast forward a decade, summer of 1928. This is where the legend of the messy lab truly begins.
It's the perfect blend of preparedness and chaos. Fleming was, shall we say, disorganized.
That's a polite way of putting it.
A very polite way. He often stacked his Petri dishes, and his lab often had the windows open, which, in a London summer means dust, spores, debris, all of it was just constantly drifting in.
And our notes show that this very lack of tidiness, this messiness, it became the catalyst for probably the greatest scientific accident in history. In August 1928, Fleming goes on vacation.
Yep. Just leaves it all behind. A whole stack of Petri dishes that were growing Staphylococcus bacteria.
Okay, so this is where the narrative really slows down and the details become critical.
They really do. So when he left, it was warm in London. But while he was gone, a cold spell hit the city. And that's when the mold spore, which was later identified as Penicillium notatum, blew in through an open window and landed on one of those stacked plates.
So why didn't the mold just get instantly overwhelmed by the staph bacteria? Staph is pretty aggressive.
It's because of that temperature shift. Because it got cooler, the mold had a chance to germinate and actually start growing before the Staphylococcus could fully establish its lethal colony. If the weather had just been consistently warm, the staph would have overtaken the plate immediately. The mold wouldn't have stood a chance.
So the mold basically got a head start. Fleming comes back 2 weeks later. He starts sorting through the dishes, probably just getting ready to toss them all out. But then he notices that one single contaminated plate.
And what he saw was definitive evidence of biological warfare on a microscopic scale. There was this clean, clear ring around the fuzzy green-blue mold.
It wasn't just that the bacteria hadn't grown on the mold.
Exactly. The mold was actively pushing back the staph. It was creating what's called a zone of inhibition, a kill zone.
This is the moment that just defines his genius. It's pure observation. I mean, most scientists, working under strict protocol, they would have seen a contaminated plate, a spoiled experiment, and just sterilized it immediately.
Thrown it away without a second thought. But Fleming, in that famous, probably apocryphal quote, just murmured, "That's funny."
He chose curiosity over cleanup.
He did. He recognized the anomaly not as an inconvenience, but as a potential phenomenon. That insight, that willingness to look closer at what looks like a mistake is, I mean, you could argue it's the entire foundation of modern medicine.
So he quickly studies the mold, identifies it as Penicillium notatum, and confirms it's secreting an active substance. He names that substance penicillin.
And in the lab, it was incredibly potent. It was destroying the agents that cause things like scarlet fever, pneumonia, meningitis. The initial results were absolutely electrifying. Fleming had found a natural substance that was highly toxic to deadly bacteria, but, and this is the key, seemed harmless to human cells.
His World War I promise was technically fulfilled, right there in a lab dish.
In that dish, yes.
But this is where the story pivots. It goes from this exciting discovery to this heartbreaking decade-long frustration. This is the central roadblock in all our source material.
Yeah.
Fleming could identify the power, but he could not deliver it.
Why was purification so much harder than the initial discovery? I mean, he could grow the mold, sure, but extracting that active penicillin molecule from what they called the mold broth in a stable form, that proved to be almost impossible for him.
Our sources really break down the core technical problem. Penicillin is an incredibly fragile molecule.
Unbelievably fragile.
It's stable enough in the mold broth,
Yep.
but the moment Fleming tried to concentrate it, using traditional chemical methods like boiling off the water or using strong acids or alcohol.
The active ingredient would just denature. It would literally fall apart. Yes. It had incredibly low stability and a really low yield. He could create these small, unstable quantities, maybe enough to confirm it worked on a rabbit, but nowhere near the amount you'd need to treat a severe systemic infection in a person. He just didn't have the chemical engineering tools for such a delicate compound.
So the biggest discovery of the era just sits on a shelf. He published his findings, but because he couldn't turn this mold juice into a usable, mass-produced drug, the medical community largely dismissed it.
They saw it as an interesting lab curiosity, but not practical. It's almost a tragedy that this potential lifesaver was basically forgotten for 10 years. The world just kept losing millions of people to infections that could have been cured, all because the technological gap between the discovery and the delivery was just too wide.
And that brings us to the late 1930s, and to the team that rescued this miracle. We need to introduce Howard Florey and Ernst Chain at Oxford University.
Right. And they stumble upon Fleming's forgotten papers. And they see not just a curiosity, but a crucial, unsolved engineering problem.
This is the critical shift in thinking, isn't it? Fleming was a bacteriologist. Florey and Chain, their focus was on pathology and biochemistry.
Exactly. So they didn't focus on what penicillin did. They already knew that. They focused on how to get it out, how to extract it consistently.
They became pioneers in low-temperature extraction. They spent years working on freeze drying and, crucially, using these complex, volatile solvents like ether to gently, very gently, extract the penicillin without destroying the molecule.
And their dedication was intense. They needed industrial-scale production, but they were working in a university lab.
Right.
They famously repurposed every glass container they could find, milk bottles, bedpans, whatever worked, just to grow the liters and liters of mold broth they needed.
Their first real tests were dramatic. In animal trials, they showed penicillin could protect mice against massive bacterial infections that would kill the control group every single time. And the sources describe these initial human tests on patients with, quote, hopeless infections.
The initial results were astounding. There was one patient, a policeman named Albert Alexander. He was dying of massive septicemia after just a minor cut from a rose bush.
A rose bush?
Yeah. Florey and Chain administered their very scarce supply of penicillin, and he rapidly began to recover. It was a miracle.
But this is devastating detail in the story, though. They didn't have enough of the drug.
No. Penicillin was being produced on such a tiny scale, they actually had to reuse the drug by extracting it from the patient's own urine every day.
Wow.
Unfortunately, the infection rallied and Alexander relapsed because the supply just ran out. and he died. But that brief, miraculous recovery proved beyond any doubt that penicillin was the solution Fleming had dreamed of. The problem was no longer efficacy, it was scale.
And the need for scale became an absolute global necessity as World War II raged. The British government couldn't fund the mass production needed. So Florey took the research to the United States in 1941.
He started working with American pharmaceutical companies, and this was wartime collaboration on an unprecedented level. Suddenly, the problem of purification became a strategic national priority.
No longer a lack curiosity.
Not at all. The U.S. government and industry poured massive resources into overcoming those final hurdles. How do you ferment this mold consistently in 10,000-gallon vats?
And they figured it out. By D-Day, 1944, enough penicillin was being produced to treat every single severely wounded Allied soldier. It truly became a weapon more powerful than bullets. It saved countless lives, prevented widespread gangrene, and dramatically lowered the number of amputations.
Fleming's original WWI horror was finally fully addressed on the battlefields of WWII. It completely secured its legacy as the wonder drug. And the story of its delivery is just a powerful reminder that a scientific breakthrough often needs a whole ecosystem of expertise. Not just the visionary, but the engineers, the chemists who figure out how to turn a theory into a therapeutic reality.
In 1945, the profound impact was recognized globally. Alexander Fleming, Howard Florey, and Ernst Chain were jointly awarded the Nobel Prize in Medicine. It was so well-deserved, but our sources always highlight Fleming's consistent humility through it all.
Yes, and that humility was paired with this incredible foresight. Even as the whole world was celebrating this miracle cure, Fleming was sounding a crucial warning. He understood evolution, and he warned that the misuse of penicillin, using it too casually or, stopping a treatment too early, would force bacteria to develop resistance.
And that biological arms race is exactly what we're dealing with today. Antibiotic resistance is a massive global health crisis. It just proves that Fleming's long-term systems thinking was just as important as his initial discovery.
The numbers are just staggering. Penicillin and the entire field of medicine it pioneered has saved well over 200 million lives. And it led to the development of every major antibiotic we rely on today. It completely redefined the relationship between human being and bacterial disease.
So what does this all mean for you? Well, the greatest breakthrough of the 20th century didn't happen in some sterile, controlled environment. It happened because an incredibly curious scientist decided that a contaminated Petri dish left near an open window on a chilly day was worth a closer look.
The story just confirms the value of the anomaly. It teaches us that true innovation often comes from being observant and critically analyzing what looks like a failure or a mistake. Don't just throw away the things that don't fit your expectations.
And that leads to our final thought for you to carry forward. Building on the knowledge we've synthesized today, we know Fleming's curiosity rescued penicillin. But given the fragile nature of that molecule and just how easily a less curious scientist would have tossed that dish,
Right.
how many other potentially crucial discoveries, maybe cures for diseases we still struggle with today, might have been thrown away simply because the scientists lacked that critical moment of curiosity?
How many anomalies in your own work are you dismissing as simple contamination? Look for the fuzzy mold in the clear zone.
Thank you for joining this deep dive into the messy lab and the miracle mold. We'll see you next time.